Clinical Director of the Division of Infectious Diseases at Brigham and Women's Hospital, Dr. Paul Sachs, and Morning Joe Chief Medical Correspondent, Dr. Dave Campbell. Doctors, good morning. It's good to see you both. Dr. Sachs, let me start with you. We laid it out pretty starkly. Record number of deaths, record number of cases, record number of hospitalizations, only climbing, warns the CDC director. What is your snapshot assessment of where we are this morning?
Well, it is obviously very concerning to have these cases go up. As we've known for some time, these coronaviruses, all of them, including the one that causes COVID-19, do have a seasonality to them, meaning they get worse in the fall and winter. On the plus side, we know better how to prevent the spread of these viruses and also know that there is a vaccine coming, and we're all extremely optimistic about the vaccine results, and that is something that cannot come soon enough.
So, Dr. Sachs, Dr. Redfield yesterday was talking about December, January, and February being perhaps the worst public health moment in American history. He did say, but if we suddenly mitigate, if we suddenly have everyone wearing masks, if we actually distance socially, if we actually don't travel, if we don't gather in large groups around these holidays that are coming up, we could at least stem the numbers a bit. But what makes him or anyone believe that suddenly a group of Americans who've listened to President Trump, for example, and ignored all of these warnings from the CDC and from his own White House task force, what makes you think anything would change now?
Well, one thing that has changed is we have, as I mentioned, a better understanding of how the virus is spread. I also am very hopeful that testing will become much more broadly available. There's a lot going on in the background with testing. We've always suffered right from the very beginning with a shortage of testing and a difficulty in accessing tests. But if we look at the technology that's in development, very soon we should be able to have access to tests quite readily and quite inexpensively. And that will enable people to get tested and, if necessary, to isolate, and also will enable us to have more comfort about going to work, et cetera. So I agree. This is a very concerning numbers, and this is not a trend we want to see. But there are some things on the horizon that I think can make this not as devastating as it was in the spring.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.